Assalamualaikum and hi parents. My name is Teacher Kamilia and today I will be talking about psychosocial issues affecting social participation for autism spectrum disorder students or kids. So let's see the next slides. Before we continue or pursue to that topic, I will explain to you what is autism. So, roughly, it is translated or also known as autism or ASD, is a developmental condition that affects or give issues to their communication, social, and also their behavioral changes. So, what is autism spectrum disorder by definition? So, autism spectrum disorders are characterized by abnormal ways of relating to other people, objects, and events. Secondly, they have delayed or missing speech, language, and or nonverbal communication skills. And third is restricted, repetitive, and stereotype patterns of behaviors, interests, and or activities. So there are five types of autism spectrum disorder. That is first, Asperger's syndrome. Second is Rett's syndrome. Third is childhood disintegrative disorder. Fourth is Kenner's syndrome. And fifth is pervasive developmental disorder. Based on some research and studies that have been done in the past few years, it is found that ASD is once considered rare, but now it is appears commonly among one in every 68 children. So about one third of every children with ASD exhibit delays in cognitive development and also daily living skills. They also exhibit behavioral problems such as temper tantrums, aggression, self-injurious behaviors, and also anxiety, and also medical conditions such as seizure, epilepsy, and gastrointestinal disturbance, and other illnesses that they might appear of having. So these are some of the psychosocial issues that can be found in ASD students or kids or your children. So first is lack of interest in other people. Second is lack of social reciprocity, highly rigid, inability to share attention, and also repetitive behaviors and interests. So, lack of social reciprocity is frequently manifested by extreme aloofness, lack of interest in other people, low empathy, and inability to share attention. So, or join attention with other people. So, their communication also have problems or issues and often manifested by odd nonverbal behaviors, odd tone of speech, few to no facial expressions or body gestures at all, failure to maintain proper eye contact, difficulties understanding speech or using language for conventional purposes, and also speech peculiarities, which is echolalia or pronominal reversal. So, for highly rigid and repetitive behaviors, they are often manifested by perseverance of sameness, strong attachment to particular objects, routines, or activities, and fascination by movement. Other than that, there are also other symptoms of psychosocial issues that might affect autism spectrum disorder kids that includes internal and also external part of themselves. So for internal, it includes anxiousness or anxiety, depression, social withdrawal, and difficulty recognizing or understanding other people's feelings and their own feelings. For external part of symptoms is aggressive or aggression, rule breaking, finding things like bright lights, crowded places, or loud noises are disturbing and stressful and also upsetting for them. Social interventions for children and young people with ASD that can be described as social communication interventions to address the core features of autism in children and young people that can include play-based strategies with parents, carers, and teachers that can join hence to increase joint attention, engagement, and reciprocal communication in the in the child and young person itself. So the strategies should include or should be adjusted to the child or the young person's developmental level. They have to increase or aim to increase the parents, carers, teachers, or peers' understanding of and sensitivity and responsiveness to the child and a young person's patterns of communication and interaction. Other than that, it also has to include techniques of therapist modeling and video interaction feedback. And last but not least, it has to include techniques to expand the child or the young person's communication, interactive play, engagement, and also social routines. So this intervention actually have or should be delivered by a trained professional. So for preschool, or for any young kids considered parents or carer or teacher for meditation. However, for school age children, they can consider peer meditation. That is all from me. Thank you and bye bye, everyone.